Welcome to ASHLIN Management Group's Mobilizing Small Businesses to Take the COVID-19 Vaccine to Communities of Color webinar. As we all are aware, COVID-19 significantly changed our lives in 2020. However, just 2 months into 2021, the new year has already shown new hope as vaccines have become available and thousands are vaccinated every day. Although we see our frontline workers and oldest citizens getting vaccinated in this first wave of vaccinations, it is imperative that our local communities be prepared to support the rollout of vaccines to those in subsequent waves. Small businesses in the United States account for 99.9% of all U.S. businesses. They also employ almost half of all employees in the country, employees that will be eligible for the vaccine in subsequent vaccination waves. Although our small businesses are a critical component to any vaccination strategy, there hasn't been the same level of discussion about how to engage small businesses in this important work. This is why the leadership at ASHLIN Management Group felt this webinar was so important. ASHLIN Management Group has been engaged in programs supporting public health awareness and training, as well as access to jobs and education through modern learning platforms and technology for over 2 decades. ASHLIN continues this important and meaningful work today by hosting this conversation with experts. During today's conversation, we will discuss the challenge of vaccine hesitancy, ways to communicate vaccine information more effectively, how to support communities of color in communities and in the workplace, and the role of small businesses in vaccination and communication efforts. So let's begin. I'm Dr. Ebony Haynes, Assistant Professor of Public Health at Georgia College and State University, CEO of the Mahogany Group, and consultant to ASHLIN Management Group. I'm the moderator for today's session. If you're like me, you are looking forward to life without COVID. However, like me, you probably feel inundated with the barrage of information out in the universe about COVID-19, the vaccine, its rollout, and of course, its effects. You may also have wished that you could find a single source of information specific to how small businesses should respond to all that's happening within their organizations as well as within the communities that they serve. And if that's you, well, you're in luck, because during today's webinar, our esteemed guests will help us explore a number of things. First, we'll discuss engagement strategies to ensure the delivery of the COVID vaccine to communities of color. We'll also discuss opportunities to mobilize small businesses to help get communities vaccinated faster, save lives, and help Americans put the pandemic behind them. And finally, we'll discuss approaches that will restore trust and bring an equity focus to this vaccination effort in communities of color. We aim to bring thought-provoking ideas and recommendations to our audience today, you all, and we also want to hear from you. So we invite you to submit questions using the Zoom Q&A feature throughout this presentation. If we are not able to address your question during the webinar, we will follow up with attendees afterward via email. Also, we have a website that will be shared with you that can direct you to additional resources for your organization and materials that small businesses can use as they are weathering the COVID pandemic and starting with their own vaccination efforts. As a reminder, at the conclusion of the webinar, we will also circulate a brief survey to get your thoughts about the webinar and to help us understand the additional resources and information your small business might need to support this effort. So I'm sure you're ready to hear from someone other than me. So let me introduce you to our special guest from the Cdc Foundation, who will help us kick off today's conversation. Dr. Judith Monroe is the president and CEO of the Cdc Foundation. As president and CEO, Dr. Monroe continues to dedicate her career to protecting people and saving lives. Prior to joining the CDC Foundation, she was a deputy director within the Centers for Disease Control and Prevention. And Dr. Monroe advances priority programs that improve the health of people across America as well as around the world. She mobilizes philanthropic and private sector resources to support CDC's critical health protection work, managing hundreds of programs in the United States and in more than 140 countries. So please join me in welcoming Dr. Monroe to our conversation.
Thank you so much. It's so great to be with you and appreciate that introduction. And yes, we all are ready for COVID to be behind us. I'm with you on that. So the CDC Foundation was created 26 years ago to help mobilize philanthropy and private sector resources to help extend CDC's life-saving work in the United States and globally. And we are an independent nonprofit that works at the intersection of government, philanthropy, the private sector, and community-based organizations. So while there is much that government can do, we know from experience that we can do so much more when we work together across sectors to solve health challenges and create a strong public health infrastructure. Health is everyone's business. We cannot have good business without good health, and businesses, both large and small, play a really important role, especially in serving as community partners. So unfortunately, the COVID-19 pandemic has laid bare society's health inequities. Today, Black Americans are dying at a rate of 1.5 times more than white Americans. There are many interrelated reasons for this. Behind this occurrence, there are inequities in healthcare, there are entrenched health disparities, systemic racism, as well as Black Americans comprising a disproportionate number of essential workers, resulting in higher levels of exposure to COVID-19. Also, while many Americans are experiencing an economic crisis, there is so much evidence about how the pandemic is hitting Black Americans harder than it is hitting other racial groups. According to the Federal Reserve Bank of New York, approximately half of Black-owned businesses have closed as a result of the pandemic. This is very troubling, and I'm afraid to think what the health ramifications will be from this occurrence as we go forward. But there are bright spots and there are actions that we can take. Yesterday, I want to do a shout out for Atlanta. The Metro Atlanta Chamber announced just yesterday the ATL Action for Racial Equity. This is a multi-year, multi-step action plan designed to help address the ongoing effects of systemic racism impacting the Black community. To date, more than 150 Metro Atlanta-based companies ranging in size. So this is both the small businesses and the large businesses coming together and joining in this initiative that's going to leverage the size, scale, and expertise of the region's business community to advance racial equity. The initiative focuses on measurable actions across corporate policies, inclusive economic development, education, and workforce development. ATL Action for Racial Equity will be rolling out playbooks for businesses to access focused on their corporate policies and concrete actions that businesses can take in the areas of people, talent pipeline, and human resources, inclusive economic development, education, and workforce development. ATL Action for Racial Equity is an essential step to actively engage our business community in the urgent and important work necessary to build wealth and close the opportunity gap for Black communities. So I think that's a bright spot, and we're beginning to see across the country other efforts like this taking place. Very encouraging. So together we can control the COVID-19 pandemic, and the best way to do this is through mass vaccination and adhering to the 3 W's: wear a mask, wash your hands, and watch your distance. To protect all of us, everyone should continue to practice these protective measures, even after receiving the COVID-19 vaccination. But we have challenges in our country. People are not consistently wearing masks or wearing them correctly. We are social beings and we love to be together with our family and friends. And many people are hesitant to receive the vaccine or have challenges accessing the vaccine. We know that working with businesses, including and especially small businesses, will be required to be able to really suppress the spread of COVID-19 and address the pandemic's massive economic fallout. Americans are looking to their employers for trusted information. So large and small businesses can serve as role models to inform their employees and customers about the importance of COVID-19 prevention. But small businesses are really right there in the community and know their communities well. And that's particularly important as we move into this next phase of getting folks vaccinated. In addition, you can offer flexibility and incentives to employees to help encourage vaccination. Some businesses are beginning to provide paid time off to have employees be able to get vaccinated, or maybe take their elderly parent to be vaccinated, or an elderly neighbor, as an example. Small businesses in the Black community can play a vital role as trusted messengers. It's imperative that governmental public health agencies and entities that are part of the public health response see small businesses, along with faith-based organizations and community-based organizations, as critical partners in getting out these key messages on the safety and importance of vaccines. So to prepare businesses for this role, there is actually a lot of information available about the pandemic and practices on how businesses can help respond, including educating their employees and customers about COVID-19. I recommend that small businesses review CDC's COVID-19 workplace and businesses information on cdc.gov. In addition, the CDC Foundation, with partners in mid-February, will be launching a new alliance targeted to businesses. The alliance will provide resources to both small and large businesses about how to communicate important topics to their employees and customers. And the alliance will offer best-in-class tools and resources free for the business community. So while the COVID-19 news has been challenging, I believe hope is on the way, and I look forward to continuing to work with the business community, including small businesses in particular, to end the pandemic and work toward returning to a time that more resembles what we remember as normal. So thank you.
Thank you, Dr. Monroe. I really appreciate the fact that you highlighted early on in your discussion that health is everyone's business, and that businesses, large and small, have to be engaged in this effort. And not just in the effort to promote vaccinations, but also to do those things following the 3 W's that you mentioned, that they have to be at the forefront of those efforts as well. And as you were speaking, it reminded me of something that Dr. Kamara Jones mentioned that was quoted in the most recent edition of The Nation's Health. And she talked about how, businesses need to be engaged in this work, but also that there is a need for us to build trust among minority communities, which has been a common thread in conversations that we've been having around COVID-19. But she also talked about how we needed stronger protective actions on other fronts, such as enforcing safer workplaces and ensuring that frontline workers and essential workers have the adequate protective equipment that they need. And so as you were talking about the 3 W's and then reflecting on what Dr. Kamara Jones mentioned, it really says that to me that we also need to encourage our workplaces to really start thinking differently about policies and implementing effective policies. So can you share with us, from your perspective, what we need to do differently from a small business perspective to implement effective policies, or what do others need to do in order to support small businesses in implementing effective policies until we have COVID-19 under control?
Yeah, no, that's a terrific question and critically important. And I think a lot of folks are having these conversations now. So going back to the initiative in Atlanta, this really will be focused on policies and giving folks the playbook for how they might change their policies within their organizations. But you said something else. The small businesses at the start of all this needed to protect their workers, but they couldn't always get the personal protective equipment, if you'll remember early on in the response. And so I think we've got to society at large, and this is where large businesses can help small, or where there's funding available to help small businesses be able to have, whether it's whether it's the signs for their customers, because imagine you're the small business, you're the dry cleaner, or the coffee shop, or the where you get your haircut, right? But as human beings, we need reminders, and we need to hear the message consistently. So wearing the mask correctly, just wearing the mask to start with, and wearing it correctly, those kinds of things can really help a lot if small businesses have the tools and they become part of the messenger. And then protecting their own, I love that, because we do need to, every employer needs to think about protecting their employees beyond COVID. So I think to the point being made, we need to be thinking beyond that. And that's what Atlanta is really taking on. I think that's why I think if we look across the country, we're beginning to see these bright spots. So I would look to them for more to come on your question.
Absolutely. Well, I'm excited about this work that the Atlanta Action for Racial Equity is doing, and we will make sure that that information is posted on the resources website so that others will have an opportunity to learn more about that as well. So thank you for sharing that information with us, Dr. Monroe.
My pleasure.
So at this time, I would like to move into another portion of our program, and that is an opportunity for us to hear from a panel of experts before we actually have them all together for our Q&A session. So we believe that it was important that each of our panelists provide their perspectives on things small business owners should consider during this time. We've asked each of our panelists to take about 5 minutes to share their thoughts on a question or two that I'll present to them. After each of our panelists has had an opportunity to share their perspectives, we'll bring them all together to answer questions you may have for them. Again, we invite you to submit questions using Zoom's Q&A feature at any time. If you'd like your question directed at a specific panelist, please note that with your question. So joining us today are Dr. Lauren Smith, Chief Equity and Strategy Officer with the CDC Foundation, Dr. Krista Marie Singleton, Associate Director for Science, Science Lead for the CDC's COVID-19 response, and Chief Equity Officer at CDC, Dr. Akila Shah, Assistant Professor focusing on allergies and immunology at the University of Arkansas for Medical Sciences, Dr. Catherine Milkman, Professor at the University of Pennsylvania's Wharton School and co-director of the Behavior Change for Good initiative. And finally, Dr. Peter Marks, Director for the Center for Biologics Evaluation and Research at the Food and Drug Administration. Dr. Marks will join us via recorded message initially, but he will join us in person for the Q&A session. Now, I'd like to introduce Dr. Lauren Smith from the CDC Foundation as our first panelist. Dr. Lauren Smith has worked at the intersection of healthcare delivery and management, public policy, and the public health for over 25 years. She drives strategic efforts to embed health equity across the Foundation's COVID-19 response activities, with a focus on addressing systemic racism and its impact on vulnerable populations' resiliency amidst the pandemic. As co-CEO of FSG, one of the world's leading social impact consulting firms, Dr. Smith led the firm's U.S. health practice and helped advance FSG's mission of achieving lasting and equitable social impact. So please join me in welcoming Dr. Lauren Smith. Dr. Smith, COVID-19 has disproportionately affected racial and ethnic groups. How can we mobilize small businesses to help address this disparity?
Well, thank you so much for having me and for hosting this session, because I think the sharing of this kind of information is really essential. And I would just emphasize that the effective and comprehensive, and by that I mean complete and full and equitable vaccination of our communities is really essential to opening the economy and rebuilding it so that we can move forward, as you said at the beginning, to see how we can put this behind us. The business sector has numerous important roles that it can play, some of which Dr. Monroe just highlighted. I would bring up just a couple more for your audience to think about. When we think about partnering with local and state public health, healthcare, community health centers, federally qualified health centers, and importantly, community-based organizations, that's so that everyone can have a shared understanding of what are the needs of the small businesses, community members who are their employees and their customers. And in that regard, I wanted to just highlight as an example that for this vaccination process, for this pandemic, we need to have a really clear understanding of the science behind the vaccine. Many people don't really understand vaccination in general. They definitely don't understand this particular vaccine, which is a new kind, an mRNA or a messenger RNA vaccine. So we need to have a way to describe this in a way that's accessible and understandable and really addresses people's underlying concerns and needs. So that's a key important part. The second piece around providing accurate and understandable information from credible sources. There is so much information that is rampant. There are what people call zombie rumors that just reappear. They never seem to die. They just sort of morph to whatever's sort of new and out there. So there's that. But we need to acknowledge and really understand that concerns are coming from a place of shared understanding, shared experiences, and a recognition that there have been real missteps both in science and in healthcare, and that people are experiencing currently disparities or inequities in their health. So we can't dismiss in people's concerns. We have to acknowledge, listen with empathy, and then be able to respond. And then I guess the last thing I would say about this topic really is to encourage, as Dr. Monroe did, for small businesses to get information that's relevant to their setting, to their kind of business. For example, with essential workers, there's a particular CDC toolkit for employers of essential frontline workers. That's the kind of thing we can go to. You can share it with your members of your peer organizations and work on it together. So I think that the importance of having the information, having the partnerships with others in the community so you can have a really thriving or robust cross-sector partnership to be able to address these issues, and then being able to really reinforce the prevention measures that we were talking about, like hand washing, wearing a mask, watching your distance. All of those are things that especially the small business community can have influence by making those things normal and accepted so that people experience them when they're moving through the community.
Wonderful. Thank you so much, Dr. Smith. As you were speaking, it reminded me of the fact that small businesses employ almost half of the people here in the United States. But when we think about the owners of those small businesses, those individuals may likely be part of those communities that are most at risk for a serious COVID infection. And so how do we do a better job of helping the owners within those small businesses recognize their own vulnerability, and then also working with them? How do we work with them to then communicate information to their workforce that also may be part of those communities that are most at risk?
Well, this is where that partnership really comes in handy. So connecting to the public health authority or the healthcare systems, other sources of credible, accurate, up-to-date information, but then having that network of the chambers of commerce or the local small business association, so that there's a network to share the information, but you have a source of the correct and up-to-date information. And so that's one of the benefits of having those kinds of connections. And in some communities, those already exist. And in other communities, this is an opportunity to build them, a real requirement to build them. And the good news is that once you build them, they'll be helpful not only for this, which is really important, but to maintain them and sustain them, because they can be of benefit to the community going forward.
Absolutely. Thank you. It just reminds us how important it is, even for small businesses, to really get connected to those industry associations, business groups on health, chambers of commerce, and the other groups that you mentioned, so that they can be assured that they're getting accurate information. And one of the other things that you mentioned was the toolkit for employers of essential frontline workers. And that information is available on the website that everyone will be directed to at the close of this webinar. So we encourage everyone who's tuning in today to make sure that you check out those resources and that toolkit for employers of essential workers, so that you have the best information, so that you can make sure that your employees are being assisted in the best way. So thank you so much, Dr. Smith, for your discussion today, and for this dialogue that we've been having. I've written a couple of notes, so I will definitely take that back and use it for good. So thank you so much. All right, well, next we will invite Dr. Singleton from the Centers for Disease Control and Prevention to join us on screen. Dr. Singleton is the Associate Director for Science and Chief Medical Officer for the COVID-19 response, as well as the Chief Health Equity Officer for the CDC. She is also the Senior Medical Advisor in CDC's Office of the Associate Director for Policy and Strategies, Population Health and Healthcare, where she serves as the Senior Medical Advisor regarding planning and with commercial insurer partners and physician providers regarding clinical to community population health interventions, with the goal of improving health and controlling costs. She represents CDC on the National Alliance of Healthcare Purchaser Coalition's Board of Governors, where she serves as an industry expert. She also serves as a steering committee member for the Atlanta Regional Commission for Health Improvement. So welcome, Dr. Singleton.
Good afternoon.
Good afternoon. So I'd like to know, as the Associate Director for Science and the Chief Health Equity Officer for the COVID-19 response, how do you think small businesses can help reduce health disparities and bring opportunities for access to good health to communities of color?
Great question. I also just want to slightly clarify, I am representing the Chief Health Equity Officer unit, but we do speak as a unit, and we are very encouraged and excited about the opportunity that the pandemic has brought us into actually putting the topic of health disparities front and center, so that we as a country can move forward with eliminating these health disparities. One of the things that, as you mentioned, that small businesses employ over half of the workforce, it's an opportunity for that workforce and those employers to bring those perspectives to the table for when health planners, community leaders, health insurance companies are designing health services for their employees. If you represent half, that data is important. And for one way to help inform that data, it's important that small businesses identify opportunities. Right now, we're focused a lot on the COVID vaccine, but it's important to get their concerns of the employees to the table, so that messages and services can be matched to these intended audiences. A few years ago, there was a push for workforce health and workforce improvements. And often those services were thought about and designed, well-meaning, but from corporate spaces and not as closely aligned with the workforce in mind. So we would offer that small businesses can help flip that script a bit, that they can meet with their employees and hear what their workforce concerns are about health and around like the vaccine right now, so that services can be brought to them. The second way is that small businesses, particularly small businesses with large workforces of color, can be that data source. So as healthcare organizations now, thankfully, are recognizing that they need to provide healthcare services, the small businesses, as my colleague Dr. Smith just mentioned, can join in part of these business health collaboratives to share, here's what we represent, here's what we are bringing to the table, and here's where we would recommend the services come to our workforces, either on-site, near-site, because again, it's a win-win opportunity. Another way it's a win-win opportunity for small businesses to inform this conversation. The healthier the workforce, the more health competitive the community. A healthy community can then attract additional economic opportunities. So I'm sitting here in Atlanta, Georgia, and I'm reflecting upon a conversation that our office had with individuals in a city to our south in Savannah. And one of the challenges that Savannah was having was that they were trying to bring new businesses to that area, and the needs of those businesses, those economic opportunities, were to have workers that could physically compete in that space. And so taking a step backward, the healthier the workforce means that the community can then support these new economic opportunities. So it's a win-win all overall. So the small businesses, particularly those that have workforces of color, can say, hey, we're here, we have this workforce, we are not only a part of the community, but we are an active contributor to the community. And here's where we can partner with you to make our community more health competitive and actually bring more income so that we can all benefit from that perspective. And then again, lastly, again, sharing that workforce data with health departments, health plans, these community business coalitions. By you all bringing that actionable information to show when we are not in session, when we are not able to conduct our business, here's the impact to our community. So that's we then need these additional supports with all of us together to improve the default option being the healthier option for these groups. Looking at the social needs and social risk factors for your workforce can inform community health solutions. It's not just about having the operation open, but if you have workers that have challenges with transportation or challenges with getting access to food, then those can inform those community health solutions as this time where we can help reduce health disparities. So I'll stop there and look forward to further communication.
Thank you, Dr. Singleton. You made me think of a number of questions that I'd love to jump into with you, but I'll just ask a couple of them. So as you were talking about how the healthier the workforce, the healthier the community, the better the community is able to take advantage of opportunities or compete for economic opportunities. And I think that that's just, it's profound, and you know, intrinsically we know that, right? But to really put it out there to help people recognize the connection between health and economic stability and economic advancement within a community, I think is something that we all need to be reminded of. And then one of the other things that you suggested was that small businesses can share workforce data with health departments and health plans and others. And I think so often we naturally kind of see how we share information with decision makers like our elected officials. But how should small businesses go about sharing information with health departments or health plans or those community coalitions or business coalitions when maybe they are not accustomed to doing that? Maybe they are a very small business, a mom and pop shop, and this is not what they normally do, but this is really impacting their business and the community that they serve. So can you share a little bit more about how they get involved in that work?
Well, I think that's a great question. It's a two-part component. I'm not going to, I would say actually a lot of the onus is actually I'm speaking to the health departments that might be listening to this call and the community planners to be on this call, because I'm sensitive to the mom and pop shops. They're just working hard just to provide income and be contributors. And so they, in turn, the onus shouldn't necessarily be on them to seek out these health departments. That being said, so that's why I kind of push a little bit on. I'm speaking to those of you who are representing those larger organizations to recognize that as you think about these plans, there are I think now some financial incentives for you all as health departments to plan with the community. Well, think about as you plan for with the communities, don't just look at the larger corporations. So again, here in Atlanta, don't just think about Home Depot and Delta Airlines, those important community partners, but look around to say, where are the networks of businesses that might inform what we're doing? Look at the zip codes and the census tracts in your area, and then look at the companies that are there, look at the businesses that are there. And as you start to plan these community assessments and build your responses to some of the federal funding that's coming your way, those businesses will be the ones to whom you reach. So that's on to the health department I'm speaking, and those community planners. The flip of that is that small businesses, we would encourage you all to be on the lookout that your health departments and your city governments, your local governments are going to be making these planning agreements. And so that's a place for you all to reach to say, hey, we represent and we serve this part of a certain zip code, and here's what we're bringing to the table, and here's our income, and here's the types of people we serve that are part of your list, and we want to be a partner with you. So it's a two-part place of it.
Thank you for that. A couple of months ago, I was working with an organization to help write a grant to provide some support to small businesses in a couple of metropolitan areas. And one of the challenges was, being able to connect with business owners to get some information about their workforce and some of the challenges that they were experiencing. And many of those small businesses were not connected to their, Latino or Black chamber, and definitely if they weren't connected to those, then they weren't connected to the Chamber of Commerce in their area. And so as the health departments and others are seeking data specifically for this opportunity, are there opportunities for them as they are doing their work post-COVID to more meaningfully engage with business leaders on a regular basis? And what might that work look like?
Sure, that's a great question. One, as I'm sitting here looking at my camera and looking at this Zoom platform, I'm reflecting on some of the community engagements our office, the Chief Health Equity Office Unit, has done over the last couple of months, where we have partnered with some of the local elected officials here, who then go to some of the churches and some of the counties here, and then in those networks bring these businesses to the table. And so they're starting to come to these forums. And that's one way to get information out to the smaller mom and pop groups to say, this is an opportunity to hear your voice. And so that's one way that just immediately came to mind. But we recently did one, again, sitting here in DeKalb County with one of the local officials, and when we looked at the numbers of people that were coming, she did that outreach to these mom and pop groups. And so they came to the table. And so if I'm thinking of the local shop a mile from my house, the likelihood of them hearing about a Zoom call is pretty small. But if someone reaches to them and says, hey, can you log on to this thing? So that's one opportunity. And then for those that are not in tech savvy or may not have that support, that's when, again, we, the health planners, need to bring these events to the businesses rather than make them jump the hoop to come to us. It's like bring it to them so that they can be part and get this information.
Excellent. Thank you so much for sharing that with us. At this time, I'd like to just pause and remind our participants, our attendees, that they are more than welcome to submit questions via the Zoom Q&A function. Please let us know if your question should be directed to one of our panelists, and we will make sure that we ask those questions as we're approaching our Q&A session. And so with that, I'd like to transition to our next panelist. Dr. Akila Shah is a former postdoctoral fellow in the Department of Bioethics at NIH. In addition to her training at NIH, she completed postgraduate training in health policy and bioethics at Georgetown University. She also served on faculty at the University of California at San Diego and at Rady Children's Hospital in the Division of Allergy, Immunology, and Rheumatology. She joined the faculty at the University of Arkansas for Medical Sciences as an assistant professor in 2020. She cares for patients with an array of allergic and immunologic diseases, including primary immunodeficiency. So welcome to the screen, Dr. Shah. It's good to have you. And so I'd like to ask you, as a physician, can you share your perspectives on how patients in communities of color may respond to treatment and information from outside the community?
Definitely. Thank you for having me. I'm very happy to be here with all of you today. So I think small businesses have a very important role in the community, mostly for people who have roots there in specific communities of color and other types of communities. So when I think about small businesses, I think of them as trusted resources, people who've lived there for a long time, people who know a lot of people and can really get the word out about different things, whether it's from a medical standpoint, a vaccine standpoint, or any other sort of standpoint. With COVID-19, I think small businesses can be, for instance, a site for vaccinations in the same way that many were a site for testing at the beginning of the pandemic and still currently as the pandemic has been going on. Especially neighborhoods where there are transportation barriers, having walkable sites is really important. So being able to walk just down the street to whether it's a church or a community group organization, or it's a neighborhood grocery store or a neighborhood pharmacy, to have those resources available to you where you are is very important. And then also to have people that you know who are the ones who are giving you information, giving you testing, giving you treatment, giving you vaccinations, if possible. The other thing is that, as I mentioned, small businesses are really well positioned to be sources of good information. And so it's a place where, for instance, the departments of health or universities can partner with businesses and communities to provide good kind of standardized information about things like COVID-19, about vaccinations, whether it's, telling fact from fiction, and really push the good information out there, the good data that we have, and really battle the misinformation that we've been having throughout the entire pandemic and the dissemination of misinformation. This has been used in other types of disease processes. So in HIV, we use community groups, organizations, and small businesses to get word out about testing, about how to prevent HIV in your community. The same thing for treatment and other things with hypertension, with diabetes. We utilize these resources that are right where people live to be a good source of information for them, especially at a time when sometimes there's not good information that's readily available to people. The third thing I would say is that during these uncertain economic times, partnerships with small businesses and the government, whether it is local or federal, is very important to help those businesses as the economy has had such a downturn in the past year. And also, while you're helping the business, you're helping the community at the same time. So for all those reasons, we can really get behind small businesses to help them, but then also to help them help their communities. And I think to the point that many of the other speakers before mentioned, really meeting people where they are is important here, and making sure we don't make people jump through too many hoops to get good information, really bring the information to the people. And small businesses, I think, are a very good way that we can do that as far as partnerships with the departments of health, with the government, local and federal, and then also to really provide good information to people. So I'll stop there.
Thank you. One follow-up question that I have for you is, as we're talking about partnerships, and we consistently heard today and in other webinars and in other newspaper articles and online articles and news reports, that the partnership piece is so key to us being able to move beyond COVID-19. So as we think about partnerships, what are some strategies that, from your perspective as a medical professional, what are some strategies that the small businesses can use in order to engage with healthcare professionals in their local community, or vice versa? You know, how do they connect and start working meaningfully together to address COVID in their local community?
That's a great question. So, I think a big part of it really is making sure that the people who have the information, which are typically, and I'm sorry, my phone's ringing in my office, that are typically, let me quit that. Sorry. So making sure that the people who have the information are the ones who are bringing that information to small businesses. So again, I think as Dr. Singleton mentioned, the onus should not be on the businesses to figure out how to navigate these different kind of large bureaucracies, right? These departments of health, the CDC, all of that kind of stuff. We really should be bringing the information to the people. And so it's very important, I think, for the local and state governments to realize that particular piece, that they have to reach out so that small businesses know what's going on. At the same time, small businesses can, try to navigate, whether it's looking at websites or calling around and things like that, but it's really not the most, what I would say, the most kind of best way to use their time and their efforts, right? And so we have to think of ways where kind of from the top, we can provide information to people so that they can then provide information to their neighborhoods, to the people who are buying from them, the people that they're servicing. And I think that's probably the best way to go about it.
Thank you for that. All right. Thank you, Dr. Shaw, for those comments. At this time, we will transition to our next panelist, Dr. Catherine Milkman, professor at the Wharton School at the University of Pennsylvania and also co-director for the Behavior Change for Good initiative. Dr. Milkman is a James G. Deanan Professor at the Wharton School. She holds a secondary appointment at Penn's Perelman School of Medicine. Her research explores ways that insights from economics and psychology can be harnessed to change consequential behaviors for good, including vaccine uptake and discrimination. She is widely published in leading social science journals, including Management Science, the Proceedings of the National Academy of Sciences, and the Journal of Finance. She has been featured on NPR and in the New York Times, the Washington Post, the Financial Times, and Harvard Business Review. So welcome to the screen, Dr. Milkman.
Thanks for having me.
Having you today. And so we'd like to know, as a behavioral scientist familiar with the impact of communications on disadvantaged and marginalized communities, are there some specific steps that small businesses can take to encourage communities to participate in taking the vaccine?
Yeah, absolutely. And actually, one thing I really want to emphasize is while I think a huge amount of attention, for good reason, is being paid to addressing the hesitancy issue and thinking of it as a persuasion challenge, which it is, making sure people feel comfortable with this vaccine, it turns out another way we can increase vaccination rates very efficiently is addressing a related issue, which I think of as the action intention gap, making it incredibly easy to get a vaccine, making it so that forgetting is unlikely to get in the way. So let me say a little bit more about each of those things. So it turns out that a lot of the time, even when we have some vague intention, like we've been persuaded and we're comfortable with the idea of getting a vaccine, we still don't follow through. And it turns out about 40 to 70% tends to be the follow through rate on behaviors we say, yeah, sure, I'm open to doing that. So 40 to 70% follow through is a very low rate. And this is true for important health behaviors like cancer screenings. It's true for voting. It's true for getting other vaccines. And so if we can close that gap, we can make a big difference. One way we can close that gap, behavioral science shows us that's very simple, is just make it incredibly convenient. If it's incredibly convenient, if we're offering vaccination clinics at the workplace, everything's free. All you have to do is sort of walk in and walk out, not a lot of paperwork. That actually is going to have a huge impact on take up. And it may seem like it wouldn't affect persuasion, but it actually can, because you start seeing, oh, everybody else is doing it. It's so easy. You see all of the other people rolling up their sleeves who are in your community, who were comfortable doing it, but might not have followed through because of this action intention gap, but they are following through. That's really persuasive, because we follow social norms set in our communities. So let's make it really easy. My team at the University of Pennsylvania has been spending time working with 2 large consortiums to run randomized controlled trials on the kind of messaging that seems to nudge people to get vaccines. And we've been actually focused this fall on looking at messaging that would encourage people to get the flu vaccine, which might sound, okay, that's different. It's been around. There's some different anxieties, but actually there's a lot of similarity. Only about half of Americans get the flu vaccine every year, in spite of the recommendation that they all receive it, which is roughly what we were seeing in terms of people's stated intention to get the COVID vaccine. So we used that as a proxy and tested dozens of different messages that might translate. So they were meant to be very generic messages that you could imagine using to encourage flu vaccination or COVID vaccination. And we partnered with both Walmart pharmacies on our work, as well as 2 large regional health systems, to see what messaging was most effective. And a key takeaway for us was that very simple text message reminders can be very effective in getting people to follow through on vaccination. We were able to increase vaccination by up to 10% with simple messages, letting people know that we had set aside a vaccine and it was waiting for them, or reserved for them. That kind of language, it's already there for you, we're expecting you to come get it, was very compelling. And I think employers can do that if they're hosting clinics on site, which hopefully will become possible in the months ahead. And then we can complement those clinics with messaging around, this is, everybody else is getting them. We've got one for you with your name on it. Here it is. We're expecting you to come and get it. That kind of messaging is likely to really be effective.
Oh, wow. This is the first time I've heard that, and not because maybe it's not out there in the public space. It's just because there's just so much information that all of us are being inundated with at this time. But I think that that's really fascinating, that we should take advantage of those types of pushes, like that push notification, and that, we're waiting for you. So your vaccine has been reserved. So come get it. I really like that that's an opportunity. And while you were speaking, it reminded me of this information that I became aware of last month. I think in December, the Kaiser Family Foundation implemented a study, and they found that 71% of adults now would be willing to get a vaccine if the scientists said it was safe and if it was available for free. So you mentioned earlier in your comments that, if individuals know that they can get it, it's available, and it's at no cost to them, then they're more likely to take advantage of it. So I really appreciate you bringing that to the forefront for us. And also, I think for small businesses, one of the things that today we can appreciate during this conversation is that you mentioned that we shouldn't look at this as a persuasion effort, and really look at it from addressing this action attention gap and making it incredibly easy to get the vaccine. And so, do you see that with and I'll just ask, and if you're not sure, it's okay. We can follow up with another question, but it almost reminds me of efforts that we see in communities where we have health clinics that are being placed in grocery stores as an effort to as you're going about your day-to-day business, to not forget about health. And it's so easy for you to go get your flu shot, or, to get that thing that you've been putting off getting looked at your doctor's office for so long. Go do it while you're at the grocery store before you start your grocery shopping. Are those two things, are they parallel to each other? Are they a very similar construct? Or do you see maybe that the push with this vaccination effort and how we engage people in the conversation around that may be a little bit easier than what we're doing with just efforts to make it easy for people to go to the doctor.
It's absolutely right. It's the same principle. And one of the things that behavioral science has proven time and again is that we underestimate how these little, I'll say hassle factors, how dramatically they affect people's decisions. So we tend to think like, oh, this is so important. People will of course take action on it. But in general, even the slightest hassle factors can have a huge impact, a huge reduction impact on how likely people are to follow through. And so as we've become more sophisticated as a society and we're concerned about the increasing cost of healthcare, you're seeing a lot of innovations where employers and pharmacies and supermarkets are recognizing this opportunity to eliminate those hassle factors and improve outcomes for citizens, employees, customers. The easier we can make it in general to get your healthcare, the more likely you are to do it. Even when it seems like, God, this is going to save your life. Of course you'd wait in line for it. The answer is some people will, yes, but some people won't, because hassle factors do have a big impact and our lives are busy. And truly, the research suggests that people who are most burdened by hassle factors and likely to be turned off, they're the groups that are already at a disadvantage, because the groups facing poverty, groups facing lack of time resources, childcare challenges, anyone who's taxed heavily, those hassle factors are even more insurmountable. And so we really just want to make this as easy and hassle-free as possible so that you barely even have to think about it. It just, wow, it happens. I wrote an op-ed for The Economist. They invited me to write about what I thought would help with vaccine hesitancy and sort of take up where I talked about this. And one idea I threw out there, which I'll admit is silly, but that's part of why I threw it out there, was like, it would be great if we could basically have a fleet of ice cream trucks driving around the country and offering vaccines. And there's like two benefits. One, you literally walk to your street corner when you hear the ding, you get it, you're done. Like, could not be easier. The other, it has a positive association if you could give people that, ice cream right afterwards. So there's something they're looking forward to in addition to the jab. It'd be nice if we can find ways to sweeten the deal. So whatever little anxiety we have about how, it might not feel good, are there ways to alleviate that by making something pleasant happen in association with the experience? So people have talked a little bit about, can we give people cash rewards when they get a vaccine? I'm open to that idea. I do think whatever we can do to sweeten the deal is great. I have some anxiety because there's research suggesting that when we pay people to do things, especially in medicine, it can increase their perception that it's risky. And that's already a big cause of hesitancy. But there may be other things we can do that don't involve payments, but lottery tickets or other sorts of prizes that are exciting and fun, but don't feel coercive in any way, that could sweeten the deal, or ice cream cones.
Or ice cream. And I love the pun. We'll sweeten the deal with ice cream.
There are many puns, right? We want to move the needle on vaccinations as well. So
and yes, the lottery ticket would work too, especially when it's when the jackpot is so high, like it was just a couple of weeks ago. So absolutely. Okay, well, this is fascinating. And just like businesses, large and small, have the blood bank come and do the blood drive while people are at work. You're already at work. So, you spend the extra 15 minutes there so that you can donate blood. It sounds like having small businesses be a site for vaccinations it makes sense, right? It just is a way for us to very easily remove many of those barriers that you mentioned earlier. So I really appreciate you bringing that to the forefront.
Absolutely.
Thank you so much, Dr. Milkman.
My pleasure.
Next, I would like to transition to our recorded presentation from Dr. Marks. Dr. Marks is the director of the Center for Biologics Evaluation and Research at the Food and Drug Administration. Dr. Marks has been committed to facilitating the development of biological products and providing oversight throughout the product life cycle. And this work has included providing advice during product development, evaluating applications, and making approval decisions based on safety and effectiveness data, and monitoring the safety of biological products and conducting research that supports product development and characterization. So at this time, we will hear from Dr. Marks.
Hi, I'm Peter Marks from FDA's Center for Biologics Evaluation and Research. Thanks for joining today. I just want to take a couple of minutes and go over the safety and effectiveness of the vaccines that prevent COVID-19. It's important for everyone to realize that these vaccines were studied in a cross-section of the country, and we're confident that they work in all people. About 10% of the people in the studies were Black or African American, and about 20 to 25% were Latinx. And that gives us confidence that when all people in our country take these vaccines, they'll be safe and effective. Now, it's really important that all of us go ahead and get vaccinated if we can against this. And we know that minority communities particularly have been devastated by COVID-19, and therefore getting vaccinated is really important. We can be confident that the vaccine is going to be safe and effective in all populations, and so we need to make sure that this word gets out there. It's normal for people to be somewhat concerned about something new like a new vaccine, and therefore it's important to get out the word that the vaccine is safe and effective. It's important to make sure that people know where to get answers to their questions. And so you as a small business owner can potentially help in that regard. You can help by example, by going out and getting vaccinated, and by having information about where people can go to get vaccinated or where they can get information just about the vaccine. Because we're sure that if people get information, if they're informed, if we combat the myths, that people will get vaccinated and will be able to bring COVID-19 under control. Thanks for all of your efforts, and please be safe.
Thank you, Dr. Marks, for those remarks. And at this time, I'd like to invite all of our panelists, including our guest speaker, Dr. Monroe, to join us on screen for a Q&A session. And now that each of the panelists has had an opportunity to share their perspectives, they will have an opportunity to take some questions from you all. So again, I invite you to submit questions using the Zoom Q&A feature at any time. And again, if you'd like for me to direct your question to a specific panelist, please note that with your question. And I'd like to begin while we're waiting for those questions to come in, if there is anything that has come up so far during this session that maybe you want to chime in on before we jump into the Q&A, feel free to take a minute or two to share any pressing comments that you'd like to make before we get started.
I just want to thank my fellow panelists, and I was really struck by this idea of the action intention gap that Dr. Milkman described, and thinking about how we can reduce or eliminate that gap. And especially given the fact that there's a lot of focus on folks who are hesitant, which means they're conflicted or have different feelings about it, which is understandable for all the reasons that people have said. But there are people who right now are not conflicted, they are ready. And so this action intention gap really is important to think about how we can ensure that folks who are ready right now can receive the vaccine. And I think small businesses throughout, because of all of the different ways that people have been talking about, could be a really valuable conduit and connecting point.
Absolutely, thank you for that.
Yes, I too was struck by that, because the default choice needs to be the healthy choice. And so how can we make this easier for people to get to? And as I mentioned, it should not be on the small business owner who is working the engine that is driving the economy to have to make this leap. We, as health planners, need to make that leap to bring it to the people. So I definitely support that mindset and bringing it. We're encouraged that there's now more vaccine coming and more opportunities to bring the vaccination sites to places to make that default choice the healthy choice.
Right, and on that, we are hearing now that there's going to be more vaccine going out to community health centers and federally qualified health centers, as an example, as Dr. Singleton was mentioning. So that's a great opportunity for small businesses to who may not have had connections with their community-based health centers or their federally qualified health centers. How can we support making those connections? Because we know that those are sites that are in the community, certainly are going to be aware of and know about those small businesses. So how can we support that?
Absolutely. Thank you for those comments. Well, we do have a couple of questions that have come in, so I will share those with you all. So one of our participants indicated that this is such an impressive gathering of experts, and I would totally agree with that. And she says, thank you for the insights you're sharing. She would like to get your thoughts on how effectively Operation Warp Speed is addressing racial inequity in its efforts to expand access to the COVID-19 vaccine. And
I can, this is Peter
Okay.
Marks. I can start by saying it's no longer actually called Operation Warp Speed. It's actually called the Federal COVID-19 Response Team. And I do know that right now they're looking at ways to help improve the delivery of vaccine to various minority communities, underserved communities around the country, because it's been recognized. I think it's recognized that the map is not looking like we'd like it to look. So I don't know that the solution has been fully implemented, but I think the first thing before you can put a solution in place, which I have to give a lot of credit to what I've seen so far, is they understand there's a problem and they're working on putting a solution, into place. I think just the acknowledgement that this is a major issue by having Dr. Nunez Smith in the team is a major step forward here. And so I'm though I can't tell you what the solution is, I know they've identified the problem and they're working on trying to work towards getting this issue dealt with. Part of it is getting vaccine access fixed in a lot of other ways, but then it has to also be fixed for the communities in a big way.
I'm going to piggyback on Dr. Mark's comments. Wholeheartedly agree. And the biggest thing again is if we don't have eyes on the problem, if we don't have data looking at the problem, then there's no way to address it. And so from that standpoint right now, it seems that the federal government is doing a much better job than previously at trying to identify the problem, and then so they can secondarily address it in a meaningful way. Similar things happened, remember, at the beginning of the pandemic with looking at cases, and we were not collecting data on race and ethnicity for who was getting sick with COVID-19. And until we started to collect the data, we did not know that we needed to make a change there, right, to really address that issue. So similar thing here, but I'm very happy that they have the Health Equity Task Force within the COVID response team to really address these important issues.
thank you so much for those responses. Our next question is, how does the resistance to the COVID-19 vaccine in communities of color compare to resistance or acceptance to other types of vaccines, such as influenza? Dr. Milkman, would you like to jump in?
This is not my area of expertise, but my vague understanding. So someone else, hopefully, if somebody else can answer it more accurately, it'd be great. I'll be parroting what I've heard from others, but I haven't.
No problem. Dr. Singleton?
I think I wouldn't say similar, but I think some of the same concerns are bringing forth. And so where I would offer is this is an opportunity to almost hit the pause button for a second. We're all interested in getting the vaccine out as one leg, as I call it, the four-legged mitigation stool. The 3 W's about wear your mask, watch your distance, wash your hands, and now the vaccine, that's the fourth leg. As we get to that fourth leg, people may say, well, I don't understand about the flu shot, or I don't understand this. So rather than perhaps I would offer, get the vaccine, it's good for you. It's like, okay, let's understand some of those reasonings behind the flu shot or why they might have challenges with vaccinations, period. Help to address, A, allow the space for it, B, then try to meet the individual to where they're more comfortable. And we've been seeing that if you start to have that open space, it helps to get people to make that default choice, that healthier choice.
Yeah, this is Peter Marks. I might chime in that one of the other things that we can communicate about this is a lot of people, because the flu vaccine is not, I mean, it's a decent vaccine, but it's not one of the most effective vaccines on an annual basis. It probably protects more people from getting really sick than we know, but it's in an average year at only 50% efficacy for the flu vaccine is pretty standard. And so a lot of people who get the vaccine end up getting the flu. And so you hear a lot of, resistance because people have gotten the flu. This is still, we have to communicate about that, hey, you might not have gotten really bad flu. But here for these COVID-19 vaccines, it's actually of a different scale. For the ones that are currently being put in use, these are things that have 95% effectiveness, including across all of the different ethnic groups and racial groups that were studied pretty much. So this is something where, you can send someone off for a vaccine and say, hey, this is likely going to help you, we hope. At least it will ultimately help our communities get back on target.
Thank you, Dr. Marks. The next question that we have speaks to sources of credible information. So we may need to revisit some of this for some of our participants. But this question is, where do small businesses go to connect to the right public health professionals to learn more about efforts to get their employees vaccinated? And Dr. Monroe, we have programs, I know, such as CDC's Work at Health program, which has been hugely successful. And that program has helped to establish linkages to small businesses, community health centers, and health departments. Are there similar programs or other places that small businesses can turn for information?
I'm not sure if Dr. Monroe is still on, but I'm sure Dr. Singleton can jump in as well. But the web resources that the CDC Foundation has specifically for business and specifically for business or employers of essential workers is, one place I would, absolutely send people to. The other is the Center for Black Health and Equity, which has a really terrific toolkit out as well, called Power and Immunity. And it is really community based, so it's relevant both for businesses and the community. But so I would encourage people to check that out as well. If you put that on your link,
we will definitely make sure that that's available to everyone. Thank you for responding. I have a question, two separate questions, but I'll combine them. So someone mentioned that Uber and Walgreens announced yesterday that they will work together to increase vaccination rates by providing free rides to the store. And that is practical in some communities, but not in other communities for obvious reasons. But what are some things that are being done some other things that are being done for low-income people who don't have a car and maybe are in a community where they're afraid to use the metro or other public transportation due to COVID-19? And are there any plans to use more community centers in low-income areas as an opportunity to vaccinate individuals?
So I'll give an example of efforts that have happened in my hometown or right outside my hometown. So I'm from New Orleans, Louisiana, and in the suburbs, which are mostly low income, mostly African American, on the west side of the city, they partnered with the local city council, local churches, and with the Department of Health to make a walk-up clinic and a drive-up clinic for people to come in to get vaccinated. And they were able on Martin Luther King Day to vaccinate about 1,000 people in that community who found out about it through friends and family, through the church, through other larger sources like the Department of Health. And there were some things on Facebook and Twitter and all that, of course. But the real thing was people talking to one another and saying, hey, you can just walk 2 blocks, and there are people there who will vaccinate you. I think that's really the biggest thing, because, you know, we remember lots of people don't have cars, they don't have reliable public transportation. So we really have to put these centers in places that are not only drivable, but walkable. And early on, we had, again, I keep going back to the early parts of the pandemic, issues with drive-up clinics because people still couldn't access them. So thinking of other ways, remembering that just because, you know, you have a drive-through clinic doesn't mean that people can actually get in a car and get to it. We have to make it very accessible and really meet people where they are.
Yes, I would agree. In the initial, we just here at CDC gave the sign off on what the new administration is, their emphasis on going to health centers. And I was just reflecting upon the guidance of 4 of the health centers that have been initially invited to be part of this. They're going to be, I think, several thousand of them. And the criteria for being one of the sites for vaccination is that you need to be in an area where you've got a large volume of potential patients who might be in this category. And so that is a key first step in moving that, you know, again, bringing the vaccine to the people, as well as other now companies, as we get more and more vaccine that's available, is placing those locations in locales that can offer and support the social needs of the populations that need it the most.
And I would just sort of highlight what Dr. Shaw mentioned about the partnership with faith-based communities. We are seeing at the foundation, you know, numerous examples of that around the country of either networks of churches or individual faith-based institutions who are connecting with their local or state public health departments to ensure that they have vaccine available, and then providing the infrastructure, the space, the location, their parking lot, using their buses, et cetera, to be able to get their, you know, their parishioners or their church members to be vaccinated. So that's another really important linkage. And I'm really excited about the fact that now that we know there's going to be increased funding going out to the states for vaccination, that state health departments will be able to sort of access that funding to support these kinds of connections with local coalitions, of which small businesses, you know, should be an important part.
Absolutely. Actually, just today, the Wall Street Journal had an article that focused attention on how important it is for Black pastors, for example, to be part of the COVID response and working with their congregations to get them vaccinated and being an example to their communities. So thank you for highlighting that important partner in the community as well. I wanted to ask this question, 2-part question. Someone mentioned the inventory of vaccines is very limited with long scheduling. How practical is it for employers to have on-site vaccinations at this stage of the pandemic? And also, if I'm a small business owner, can I require my employees to get vaccinated?
I can take that, though others may have some additional. So it doesn't seem like it's practical at this stage in the pandemic for most small employers to be able to be vaccinating their employees. I think that's an aspiration for a few months down the line. That would be great, especially when supplies become more available, and to the extent that the states support that. It seems like it's a great aspiration that we should be working towards that. In terms of mandating, my understanding from talking at a bunch of panels like this with other experts is that it's debated, but it seems like it's legal. It's legal to require people to get the flu shot, and many hospitals do that. Obviously, schools require vaccination, so that's not an employer. So it seems like the read is that, at least to date, similar regulations have been allowed. However, that isn't to say that it wouldn't be questioned in courts and that there couldn't be a different verdict reached. But based on precedent, it does seem like it's legal. But things could change.
I'll add one thing there. I think the one hiccup that I've had discussions with others and others similar sort of panels is the emergency use authorization status. a vaccine. So they're not fully FDA approved. And for that reason, there may, from a legal standpoint, and I'm not a lawyer at all, but may, provide an extra wrinkle there as far as mandating it on a large scale. So something extra to think about.
And if there's someone who may really truly have a contraindication, those are small, but an individual might have a legitimate contraindication for receiving one of the vaccines at this time. And so it's not an immediate yes or no. There's definitely a couple layers into that.
I think the past mandates for things like flu shot always have exceptions and exemptions that, so it's possible to get out of the mandate under some special circumstances.
Great, thank you. Two final questions. One, given that small businesses are such a critical component of communities, both urban and rural, what strategies would you recommend to engage or begin discussions on how a small business can become a vaccination site?
Well, first of all, I think there's an important thing to keep in mind that each state is different in terms of how it's organized as prioritization, in terms of what kinds of folks are included in their different groups. There's healthcare providers, long-term care facility providers, essential workers. So I think that small businesses, of course, need to be aware of, do their employees fall into those categories? And certainly if you are a store, a grocery store, other kinds of, businesses that are providing essential services, then you do. So in those settings, I think, or in those situations, I think it would be important to be able to connect with the public health authority. Again, now that increased resources are coming to the states, to be able to indicate an interest. On the flip side, I totally agree with Dr. Singleton that we can't expect every small business to be aware and savvy of all the different ways of negotiating this, these bureaucracies. So that really does mean that we need a go-between or a liaison. And I think that's the kind of role that a chamber or a small business association or someone else that might have the bandwidth to do some of that networking and connecting.
And another thought, which again, this is not my area of expertise. I'm a behavioral scientist, and but I'm just going to throw out there, it seems like at some point a way that could really work would be partnerships with local pharmacies, where maybe they, send a team, just like what's happening in nursing homes, rather than the small business sort of taking on the vaccination themselves, just becoming an outreach center where your Rite Aid or your Walgreens sends some folks to help for a couple days. So that may be a more feasible path.
And when I was speaking, I definitely wasn't sort of suggesting that small business take on the logistical aspects of acquiring and administering the vaccine. I don't think that makes sense at all. It's more like finding partners who can do that for you, but just sort of being able to identify yourself as really.
Absolutely. And speaking of partnerships, I think this last question really does help us round out this conversation. How can neighborhood associations help to address this issue? Dr. Shaw, you can take it.
Yeah. So I think neighborhood associations, you really want to know who knows the people. And I think neighborhood associations are that exact place where you can figure out who the small businesses are, who the community leaders are, who the faith-based organizations are, whatever that is. But neighborhood associations, I think, are such ripe areas of just good knowledge. And one thing that we've all sort of talked about is making sure we have meeting people where they are and understanding the dynamics of the neighborhood, the small business, the community in which you're trying to enact any sort of intervention. And so those neighborhood associations can really be a good space to really understand, rather than outsiders coming in and kind of dictating how things go, right? That usually does not work. And so really partnering, again, we keep talking about partnerships, but partnering with those associations to be as Dr. Smith mentioned, a liaison in a way to really be a bridge to gap these needs, to fill these needs.
Yeah, that's a great idea. And I think that, in many places, those neighborhood associations already have, I think, existing relationships with the municipal leadership of, if it's the town or the city or the county. So being able to tap into those, I think would be a great way of making that bridging.
Absolutely. Thank you so much. And speaking of partnerships, we'd like to thank you all for partnering with us today in bringing this webinar to our small business owners and workers. And we would implore all of you to not leave the session just yet. We'd like to thank you all, our participants, our attendees, for also collaborating with us in making this webinar possible and sharing questions that I'm sure others across the U.S. also have as it relates to this work to vaccinate communities in partnership with small businesses possible. So we'd like to thank our special guest speaker, Dr. Judy Monroe from the CDC Foundation, as well as our extraordinary panelists for their insights and guidance. So thank you so much to Dr. Lauren Smith from the CDC Foundation, Dr. Krista Marie Singleton from the CDC, Dr. Akila Shaw from UAMS, Dr. Catherine Milkman from UPenn, and also Dr. Peter Marks from the FDA. Also, we'd like to thank George Pfeiffer, who is a consultant to ASHLIN and the president of the Work Care Group, for his efforts in helping to pull this together, and also for helping us to conduct outreach to the small business community. We also like to thank the Georgia Chamber of Commerce for their assistance. To all of our attendees who joined today's webinar and participated, who sent questions, thank you very much for your attendance and participation. And also, we want to make sure that you are aware that we have information and resources available to you. So immediately after the webinar has concluded, we ask that you do two things. One, we ask that you complete the survey so that we can get your thoughts about today's webinar and to help us understand the additional resources and information your small business might need in order to support this effort. We also ask that you visit the link on the screen to access the recording of today's webinar, and also the helpful resources that were mentioned today by our panelists, as well as some additional resources that you and your business may be able to take advantage of so that you will be able to respond effectively to this COVID pandemic and to help get your employees vaccinated. Again, we'd like to thank you all for joining us today, and we look forward to our continued work with the CDC Foundation to explore ways to continue supporting small businesses across our great country. So thank you again, and we hope that you enjoy the rest of your day.